I was having headaches 24/7. They just never went away. And a lot of numbness in my hands and in my feet. Extreme fatigue, like debilitating. A lot of vertigo. I have a few different careers. I have been a video production specialist for years, for the past 25 years. I am a hairstylist. I'm also a musician. I play guitar, bass, upright bass. And with the nerve damage that was happening in my hands, it was becoming very difficult to work. I actually had to stop playing music for a while. I've gone to doctors my whole life trying to find out what was going on. I've had the headaches as far back as I can remember. So I've gone to, for the vertigo, I've gone to ENTs, I've gone to neurologists, my regular doctor, and no one was able to find it. It was by accident that it was found, from going to an optometrist of all things. So she found some tortuous vessels in my eye and referred me to an ophthalmologist who referred me to another doctor. And when he ordered extra MRI, that's when they found the Chiari. I started to look online to see if there were any support groups after I had found out about Chiari, thinking, well, maybe patients have a little more information. So I found one, and there's a Michigan site that I went on, and just a ton of information. And that's when I found Dr. Gilmer. Her name kept popping up over and over and over again.
When I met Erin, she was describing long-standing headaches, neck pain, numbness and tingling in her hands, and that was actually one of the most bothersome symptoms to her. She had started having headaches in her 20s, but in retrospect, she'd really been symptomatic her whole life. Her mother had described extreme irritability as an infant, trouble with feeding, and severe reflux, which can all be Chiari signs. If we draw a line from the basion to the opistheon here, which is the base of the skull, all of the brain should be up in the skull. And she has part of her cerebellum here hanging down, the cerebellar tonsils, into the spine. And that is a Chiari 1 malformation.
While she was also looking through my MRI and through my x-rays and explaining the surgery to me, she said, well, we don't have to do anything with your C1 because you were born without one. And that was a shock to me because for years I'd had x-rays and different tests, and no one had ever found that before.
The other thing to notice about her MRI is that the back part of the first cervical ring, which should be a ring like this, is missing here. We don't see it here at all. She just had a fibrous band or a band of tissue here where the bone should be. It's very varied as far as how it presents, the symptoms, the signs, and actually the MRI appearance, how long the herniation is, what other abnormalities may go along with it. And it's important to just treat each patient as individual. This is not a problem that can be dealt with by an algorithm or, a set of really strict criteria. But it can be symptomatic, even if it's been present from birth, and we can help patients very well with surgery for this problem.
And with all my symptoms and looking at the MRI, she believed I was a good candidate for the decompression surgery.
So at surgery, we remove part of the back wall of the skull, and usually we remove the C1, the back of C1, but I didn't have to because it was already absent in her. I just had to trim it a little bit and widen it a bit. So now we can see all of this space. The brainstem and spinal cord have actually moved backwards, and there's space in front of and behind the spinal cord. Also, the brainstem is not being compressed anymore, and there's just plenty of room, so she no longer has this compression.
When I woke up from my surgery, the pressure was gone. I had so much pressure before, and the pressure was just gone. The headache was gone. I had surgery pain, of course, but that was gone. It was amazing.
Erin did very, very well with surgery. She had no headaches after a few days after having been home. The numbness and tingling were gone almost immediately after surgery, and she was very happy about that.
My wish is for doctors to become more educated with the symptoms of Chiari and believe their patients and know to send them to a Chiari specialist like Dr. Holly Gilmer at the Michigan Head and Spine Institute.